Hello, everyone. I wanted to provide an update on relevant COVID-19 topics that came up over the past week. Overall, new case numbers in Chesterfield County have been trending downwards. For those of you who are monitoring new case numbers on the VDH website, you probably noticed an upward bulge in cases since roughly the middle of June through the end of last week, which can largely be attributed to the type of data reported, which is heavily influenced by local health department response times to case reports that come in. Factors like large data dumps and staffing levels can slow our response times and have created a lot of noise with respect to new case trends indicated on the website. For example, many of the large peaks over the last several weeks have been due to backlogs created by a large number of cases that were suddenly added to the dockets of our case investigators. Now, I'm mentioning all of this to say that once that noise is filtered out, we're seeing case trends similar to those elsewhere in the greater Richmond metro area. We've been seeing a gradual decrease in new cases since late May, early June. We're hopeful that moving forward, a good deal of that noise will be removed as our new case data will be more real time. You can see the trend in new case numbers that have been posted for the county this week. So I'm going to hit some of the data high points today, and at the same time give you some way to start looking at the VDH website if you're interested in learning more and you haven't done so already. So if you want to explore the data for yourself, please visit the VDH COVID-19 webpage at www.vdh.virginia.gov, where you can examine all sorts of COVID-19 related data at the state, district, or locality level. So overall, in terms of the data, I mentioned new case numbers, but both death and hospitalization counts, which are both very important for the county, are not showing alarming trends. Based on the frequency of each of these events, it's hard to plot clear trends, though both, like new case numbers, have been overall trending down. We've had fewer workplace, long-term care, and congregate care setting outbreaks over time, and I'm particularly happy about the impressive gains that have been made by staff at long-term care facilities. They've worked diligently to put protective measures into place, and it's paying off. There are only 2 current long-term care facility outbreaks in the district right now. COVID-19 cases among residents and staff have dropped significantly, as have virus-associated deaths in nursing homes. Another important data point to talk about is access to testing, which has grown in this health district primarily through private healthcare providers and pharmacies like CVS. The testing webpage on the VDH COVID-19 website provides data on statewide and local testing trends, as well as information about whether adequate testing is available, which is a measure called percent positivity, which looks at the number of positive test results that come back relative to the total number of tests administered. This data is presented on a daily basis. So we're shooting for a percent positivity rate, a trend rate, below 10%, and we're slightly below that threshold in this district. The health district, in coordination with Chesterfield County government, has been providing targeted free testing to individuals who might not otherwise have access through weekly community testing events. In addition to the weekly events, which will continue, over the summer, we plan on holding twice-a-month testing events on Saturday mornings that will be open to anyone in the health district who is symptomatic. The first Saturday event will be on Saturday, July 11th, from 9 a.m. to 11 a.m. at the River City Sportsplex at 13070 Genito Road in Midlothian. Call 804-318-8207 to pre-register, and we'll have 300 tests available to administer. However, again, these tests are free to anyone who needs one, but pre-registration is advised to ensure that you get tested. More information about future dates and locations will be available soon. So the final place I'd like to point you to is the COVID-19 Data Insights link, again on the VDH COVID-19 webpage, which provides case number and testing data at the zip code level. So you'll be able to view the latest COVID-19 case projections by locality. You'll also be able to view the latest COVID-19 case projections by locality based on the UVA model. All localities in this health district are tracking along what is known as the steady better detection trajectory, which is a good thing because it aligns with the slow but steady decrease in daily new case numbers that we're currently seeing. So what does all this mean? For right now, Virginia overall and the Chesterfield Health District are heading in the right direction, but we can't let our guard down. Social distancing and the basic prevention practices that are being promoted are working, but the significant increase in cases we're seeing in other states that have relaxed social distancing measures should be lessons that we should heed, especially as we enter phase 3 and with a holiday weekend in front of us. Now, if you're like me, you're looking forward to spending time with friends and family this weekend and possibly getting out a bit more. If you do, please remember to heed the following. Face covers are still mandatory indoors and public places. Face coverings are important in preventing the spread of the virus from people who aren't showing symptoms. Some studies are indicating that a significant number of people are infected who don't show symptoms, around 40% in some studies. So wearing a face covering protects others from those of us who are infected but don't know it. Second thing to note is that we should maintain a 6-foot distance between people who don't live in the same household, both indoors as well as outdoors. Remember this if you're having a cookout and inviting over friends and family this weekend. The 6-foot rule also applies to spacing between tables in restaurants. And if you go to a restaurant, bars and social gathering areas inside of them should be closed. So the basic prevention steps that we have been talking about for some time now are working and worth repeating at this point. So wear a face covering when you're inside of a public space. Again, stay 6 feet apart from people who aren't living in your home. This is important and very, very, very useful in terms of preventing spread. Wash your hands frequently. Use hand sanitizer if you are not able to wash your hands. And finally, remember to clean commonly used surfaces. Again, just because we're seeing positive trends in Virginia does not mean COVID-19 is behind us. We could easily reverse course if we don't maintain the prevention practices that we've begun, and also those that work. So I want to take a moment and highlight a group of people who have been the unsung heroes in so much of the statewide and certainly this district's public health response to COVID-19. These are members of the Chesterfield Health District Medical Reserve Corps, or MRC for short, who are volunteering their time and experience to expand our workforce, which has been stretched extremely thin as public health staff respond to COVID-19 and continue to provide other basic public health services. Many MRC are healthcare professionals, others are not. We have a roster of regular volunteers who support our community testing events, case investigations and contact tracing work, and staff our health district call center. Their service frees up health district staff to be applied more directly to critical aspects of our COVID-19 response. MRC members have been an incredible force multiplier and worth their weight in gold. So thank you to any of you who might be listening who are part of our MRC group. For anyone who's listening who might be interested in joining the MRC, we would welcome your assistance. A good place to start is by visiting the VDH website, the MRC link, which can be found at vdh.virginia.gov/MRC. So those are the major updates for this week, and I'll close by wishing everyone a safe and very healthy holiday weekend. Please take care.